Breathing in, there is awareness of breathing in. Breathing out, there is awareness of breathing out. Breathing in, breathing out. In, out. Where do we suffer? The physical body and psychological mind. Neuro Developmental Disorders, Part 2. Attention Deficit Disorder or Attention Deficit Hyperactivity Disorder, ADD or ADHD. Hyperactivity, restlessness, impulsiveness, short attention spans, and being easily distracted, as well as emotion control problems, impatience, and a tendency to interrupt others, are the more common symptoms of ADD or ADHD, affecting mostly children who become severely challenged by what amounts to an ego on steroids, a developing mind that is perhaps being driven by brain chemical imbalances imposed by a pre- and postnatal diet of unhealthy food and drink. Adult ADD or ADHD. Mood swings, challenges in focusing, chronic disorganization issues, impulsive behaviors, and communication problems leading to many and perhaps painful misunderstandings, not to mention relational stress, are just a few of the symptoms many adults experience as or otherwise are diagnosed with adult ADD or ADHD, any or all of which can further lead to heightened anxiety and even depression because feelings of inadequacy, as well as low self-worth and self-image, are invariable consequences of such a disorder. Autism Spectrum Disorder, or ASD. Little to no eye contact with others, general unresponsiveness, aversion to physical touch, and abnormal behaviors expressed by children and adolescents represent but a few of the symptoms describing autism spectrum disorder, and its effects can be relatively mild, meaning those affected can still function with some degree of independence, to severe, where the sufferers require almost continual parental care and attention. Adulthood autism. Many adults are unaware they exhibit some to many of the symptoms associated with autism spectrum disorder, because they have lived an otherwise functional life, and while their experiences may be far from warranting professional diagnosis and treatment, still, those in relationships with the affected may needlessly suffer due to a lack of awareness, let alone possess little if any understanding of the various adulthood autism signs and how to effectively work with them, rather than becoming frustrated and even hurt by their behaviors.